Hey!
Ew.
Later. Yeah.
Ew. Shall we? You recording? You started?
I
I'm
can.
cancerous.
Wait.
If I answer, sorry.
Case 2, 35-year-old male referred by a medical doctor with diagnosis of right Achilles tendinosis.
That's all you need to
He has experienced a gradual increase in pain over the past 2 years
Read slowly.
and can no longer play basketball. His
All
medical
this
doctor
time?
has recommended surgery, but he would like to try conservative treatment before considering surgical intervention.
All right, so this patient has Achilles tendinosis. Tendinosis, we're saying, or tendinopathy, because swelling is really not a part of the deal anymore. It's breaking down of the tendon itself, and we'll get into that in a second. What are typical demographics for this patient? I'm looking at age, gender, and activity level.
Age 35 to 50 years old, and gender males.
Male, sorry.
Gender males more than females.
Uh-huh.
And activity levels, sports related, so runners, basketball, football
Uh-huh.
players, and non-active individuals.
It could be an active and non-active, as opposed to other diagnoses which are more for active.
Yes.
All right, share with your audience difference between tendinosis and tendinitis. Leonitis? Tendinitis? Yeah.
Tendonitis is just an acute injury, and tendinosis involves the degeneration of the tendon due to the wasting of collagen or denaturing.
What is the excitatory afferent neurotransmitter that's involved in this?
So glad you asked. Glutamate.
I was gonna say that, but I was like, is that it?
Yes, so it's involved in pain
transmission
transmission.
and
It affects what else?
muscle tone.
Right, pain transmission and can affect muscle tone. And actually, these glutamates, there is evidence that it actually eats away at the tendon. So we got to get rid of this glutamate thing.
Exercise may decrease.
And to answer your question before, Carlos, why we do 3 sets of 15? Because eccentric exercise can actually wash away the glutamate, and that is why Alfredson does so many reps.
It's been shown.
Good. So that is what we're doing. The assessment. The patient's chief complaint. Show us, please, 2 possible anatomical areas where this patient would have this diagnosis.
Fresh size.
First side, so
I guess I'm doing it.
oh, everyone cover your nose.
So it could be midpoint, but actually like flex it.
Eye on
Flex
your
it.
stomach so we can see it. Sorry.
It could be midpoint, which is like 2 to 6 centimeters away from the insertional, which is at the calcaneus. Right there. So insertional, right above the calcaneus, midpoint 2 to 6 centimeter.
Very good. So you could be right at the insertion, which is like you said, right by the calcaneus, or mid tendon, which I don't know if it's 2 to 6, but I'll take it. 2 to 6 centimeters away from the calcaneus. Good. Good. Now, range of motion test. Again, you will have to know goniometry and manual muscle testing. What specific range of motion will be limited?
Dorsiflexion.
Dorsiflexion, that is correct. Manual muscle testing. How would you, what is weak? How would you instruct your patient to test manual muscle testing for dorsiflexion?
Dorsiflexion?
Doing single leg
So-
heel raises.
Oh, we can do the 20 single leg.
And so 20, did you guys learn that in kines or you did not?
We did it with 2
Oh,
legs
yes,
though.
yes,
The real quick
What?
one.
We did it with 2 legs.
I do with one leg, test both
I'm
sides.
here for balance.
The patient could hold on to something for sure. It doesn't have to be the therapist, unless that's what the therapist prefers.
We were shown.
That's what
No, it's your preference, it's your clinic. But the patient will have to do 20. That is full strength in dorsiflexion, okay? Very good. Now, special test to rule in this diagnosis, more than ruling it in, a special test to rule out a complete rupture. What special test would you guys do to rule out a complete rupture?
Thompson's test?
And Matt.
Thompson.
Yes,
Tomato.
Yes, show us
Thompson's
Thompson's test.
a different one.
Thomas is the,
All right. Are you gonna do it?
show us the Thompson test.
Oh, we're doing it!
Yeah. You gotta do both.
We
Affected and
have a question,
unaffected.
guys.
Yeah, we didn't do that.
We have a question.
What's your question?
Over there, Mr.
Yes.
So when he does the toe
The knee
rises,
brace.
isn't that plantar flexion?
That's testing the calf muscle. So,
It's
Oh.
the calf that's compromised.
it's the calf is compromised.
Well,
So
it's not testing dorsiflexion.
no. So why do you ask it when I made a mistake? Listen on camera. I mean, yeah, you're absolutely correct. It's not affect dorsiflexion. Dorsiflexion, we're gonna expect goniometry, but if it, you could also test plantar flexion with
You
it.
don't do this like break test or?
No, for manual muscle, we want you to do, for the dorsiflexion, what you learned in kines, but for plantar flexion, the single leg thing, thank you. Gastrocs, yes, that's correct, Russ, that's correct. Get it all out the last class, sir. All right, now, wait, if you want to rule out, if you want to rule out a full rupture, first of all, when you observe the area, you will clearly see that a full rupture is super swollen. You won't be able to even see the tendon, okay? Super swollen, but in a bad way. So what is the special test to rule in a full rupture?
What you do is you squeeze the calf. So by doing that, you're making the muscle contract and work, so the tendon should pop out. And if it doesn't, that's a full rupture.
Well, not pop out, you should see
Well,
some
well,
plantar
yeah, it
flexion.
should leave, yeah.
You should see some plantar flexion, right? If it's a full rupture, you won't
Yeah,
even
it's
see
not
the
there.
Achilles tendon, and it will be zero movement. Why do you have no movement when you squeeze your gastroc?
Barely.
My ankles crack all the time.
Oh, there is movement, okay.
Yeah, that one's
Yeah.
worse.
You really gotta squeeze. Really squeeze.
Yeah.
Oh, there we go.
Really squeeze.
Yeah, you're being too nice.
Oh.
Yes.
It's a reflex.
All right, very good. That's the first, Thompson test. What's another special test to rule in, rule out a full? Maddles? I don't know.
It's a passive test.
Yeah.
Prone, knee flexion 90 degrees, and then gravity should bring one of the foot,
Yes.
in both foot, into dorsal.
If you have no Achilles tendon, then gravity will pull into dorsiflexion.
Yes.
If you have intact Achilles tendon, then you see how you're a little in plantar
Neutral
flexion.
or plantar.
Make sense?
Sir.
All right, now, treatment. What do you guys choose as treatment?
The Alfredson's eccentric protocol.
Alfredson's eccentric protocol, because
Back pain.
injury could have occurred in eccentrics, and eccentric exercise, and there's evidence that it washes away the glutamines. So, very good. So I want you to show us, early on, phase 1, both treatment based on Alfredson for mid-tendon and insertional, and be clear what you're treating for so the audience knows.
Yo, what up?
Take it away, guys.
Are we doing mid-tendon or insertional first?
So we're gonna do midpoint, so we're gonna do the step.
Okay. I would put the step near the wall, because the patient can hold on to the
Yeah.
wall if need be, not that near, yes, so
We were gonna
facing the
hold
wall,
there.
they need for,
Or the therapist.
or they can hold the therapist's hands if that's what they're into.
That's what we were into.
That's a waste of time, especially in a busy clinic, but that's fine.
So-
Alright, so,
It's a light day.
go for it, Eric.
So let's say this is the involved, okay?
Yeah,
So concentrically, he's gonna come up with both feet,
right,
and then I'm gonna ask you to take this off the step and slowly go down,
and you see he's going past neutral,
Mhm.
that's why he's on a step.
and then
Okay.
to come up, put your foot back on the step, and you can come up again.
We don't care about concentric, we
Yeah.
only care about
Take
eccentric.
it off
Same
the
thing
step.
with, the jumpers knee, remember?
Slowly.
So, how many are we doing?
3 sets of 15 reps, and
3
twice a
sets
day.
of 15.
Twice a day.
Twice a day.
Twice a day.
And then-
And what if the patient goes, I'm in 3 out of 4 out of 10 pain?
That's
good for you.
We like pain.
Builds
Alfredson
character.
likes pain. So that's for the gastroc. Show us for the soleus.
It's the same thing, just a little knee flexion.
Same thing as the little knee flexions work on the soleus.
Yeah.
Good. A little pain, no big deal. Now, let's say we're treating now insertional. How would you change the treatment?
Alright, sir.
Get 'em
Off
off
step,
the thing.
and it's the same concept, it's just on the flat surface.
So why are we doing a flat surface?
Because
Turn around so they can see you do it.
The
Up with
tendon will
2
be-
feet, yeah.
The tendon will become impinged between the calcaneus and the bursa.
Right, if you go lower than, if you're on a step and you go lower than neutral, then it can impinge the bursa, causing more issue and even hurting the tendon perhaps.
Yes.
So if they haven't,
Two, right?
Huh?
No difference between the two methods, because the practical is gonna be insertion or midpoint,
Oh yeah, of course.
What question?
How can we forget?
15?
15.
15, question number 15, yes.
On the practical.
If on the practical you get, right, like Carlos says, we're gonna give you insertional or midpoint. If you don't treat the right one, you will not, I'm not gonna say it. All right, so that is 3 sets of 15 twice a day. Now, how do we change? About 4 weeks later, the patient comes to you and says, I feel better. In fact, I feel no pain. What do you recommend?
More pain.
Now we're adding more weight. We're doing the same exact exercises, Now with more weight, I would not add 40 pounds to the patient, but adding weight is good because Alfredson wants discomfort.
Yeah, we'd probably start
Alfredson
with-
wants discomfort. So same exact exercise for gastroc and soleus, either on the step or on the floor, depending what the diagnosis is. But now you are doing a, on a step. Now, for modalities, right? Your patient requires laser to the Achilles tendon to repair soft tissue. What would you set the laser machine to?
Well, if it's acute, 4 to 9, or if it's chronic, 10 to 15.
And you would do continuous or pulse?
You want heat?
No, this is laser.
Continue.
Continuous. You always start laser with continuous. And you use pulse if you're not getting the desired results. And of course, the patient wears the protective goggles and all that stuff. We just did phase 2, and is that it?
That's
Not
it.
each wear the goggles?
The therapist does not, but the patient must.
But aren't they laying face down? No?
I don't know how you're gonna treat them, that's up to you.
Facing down,
You gotta hold their
If they're facing down and their head's in the thing, that's fine. But if they're not, then you're gonna protect their eyes, the goggles, the eyes if they're.
Look at him kind of.
Good. All right, any questions on this group?
Look at him chicken leg.
I say clap, but for what purpose? All right, are we ready for case number 3? Case